Hi, my name is James Bennett, and this is case study number 7. The patient in this case is a 63-year-old male that presented to the ER with a 2-day history of a high-grade fever and chills. The patient also has small bumps on his extremities, his hands and his feet. The patient also stated that he had a tooth removed 2 weeks ago and doesn't recall receiving any antibiotics during that time frame. The patient has a history of an allergy to penicillin. The patient denies any IV drug use. The patient's medical history starts off with asthma being diagnosed as a child, rheumatic fever on 2 occasions as a child, hypertension for the last 20 years, type 2 diabetes mellitus for the last 9 years, an undisclosed history of liver disease as a result of alcohol intake, COPD for the last 4 years, a mitral valve replacement in his heart approximately 2 years ago. The patient's physical examination indicated a fever of 102.5 Fahrenheit. He's 5'10" and 252 pounds, which gives him a BMI of 36.2. This indicates that the client is clinically obese. The patient's blood pressure was 150/92 and his pulse was 118. The physical examination also indicated a diastolic murmur near the left sternal border. This would indicate blood regurgitation in the heart. The patient also had small tender nodules, red and purple in color, on his extremities. Lab results indicated elevated white blood cells, a lowered hematocrit of 40%, and an increased number of neutrophils. The transthoracic echocardiogram indicated a 3 centimeter vegetation on the aortic valve. It did not indicate any sign of ventricular hypertrophy. 3 blood cultures were taken to check for any bacterial infections, and all 3 came back positive for Streptococcus viridans. Based upon the blood work, lab work, physical exam, and patient history, I feel this patient has bacterial endocarditis, specifically with Streptococcus viridans. The treatment for this infection would normally be penicillin, but the patient is allergic to penicillin. Therefore, the course of treatment will be vancomycin for approximately 4 to 6 weeks to get rid of the bacterial infection. Thank you, and have a nice day.